Hello, my name is Susan Mitchell, and I'm the project director of the Sustaining Health Outcomes Through the Private Sector, or SHOPS Plus project. We are USAID's flagship project in private sector engagement for health, and over the past 5 years, we've worked in 29 countries in Asia, Sub-Saharan Africa, and the Caribbean to significantly increase access to priority health information, products, and services. We've delivered over 2.5 million couple years of protection for family planning, facilitated the treatment of 2 million cases of diarrhea among children, and reached annually 40 million clients with health messages. We've used a wide range of approaches to achieve our goal, including improving provider access to credit to help businesses grow, sustain, and improve their health practices, supporting local social marketing organizations to improve their reach, impact, and sustainability, and supporting the organization of the private sector through associations, networks, and franchises, allowing for greater integration into the health system. I'd like to start by letting you know about some upcoming end-of-project events that I'm really excited about, and I hope you will attend. We will be hosting in June a webinar series around 3 interrelated themes that have been a priority for the project. The first is government's role in stewarding the total health system, including the private sector. The second is around financing of health services, by which we mean removing financial barriers to accessing information, products, and services from private sector providers. The third is around the importance of a well-functioning health market to ensure all individuals can access a full range of quality products and services, including in the private sector. We will culminate the series with a discussion with a group of our experts on the way forward in the future, and we hope you will join us by registering for these events. In addition to the area of stewardship, financing, and markets, there are 2 additional areas that I want to be sure we highlight as they underpin so much of what we did on the project. Those are data and partnerships, and 2 forms of partnerships, public-private partnerships and corporate partnerships. But let me start with data. Whether you are a government, donor, or implementer, to design an effective program, it's critical to understand who is going to the private sector for health services, what types of providers are seeing, for what services, and why. We have used demographic and health survey and other data sources to improve that understanding, and we've developed tools like Private Sector Counts and Family Planning Market Analyzer to give us all a window into what's happening at the present moment and what would happen if we made changes. We've also conducted over 50 research studies in 15 of the countries in which we've worked. They include mapping and census studies to understand who is providing services and where, studies that evaluate the quality of care of service provision, reach and recall studies to evaluate the impact of our social and behavior change campaigns. I want to highlight a few data points from our early work analyzing and putting forth the easy-to-use formats, DHS data, to get us all thinking about why it's so important to engage with the private sector. Globally, we know that close to a third of users rely on the private sector as a source for family planning and for care of a sick child. And we know that it's not just the rich that rely on the private sector. 3 in 10 poor clients rely on the private sector as their source of family planning, and the number increases when seeking care for a sick child. But we know that every country tells a different story. If you look at this graph, you'll see at the top Afghanistan, where 50% of clients use the private sector as their source of family planning, much higher than the global number. While at the very bottom, you see Rwanda, with just 7% of family planning users going to the private sector to access their contraceptives. Given each country is so different, we've developed country fact sheets for all USAID family planning and MCH priority countries, so that stakeholders, public and private, can start with a foundational understanding of the role of the public and private sectors in the countries in which they are working. In addition to data, partnerships have been a cornerstone of our approach. One critical form of partnerships is partnerships with government to coordinate and collaborate, called public-private partnerships. These partnerships improve the effectiveness of interventions and their ability to be sustained and scaled. Over the past 5 years, we've implemented over 1,000 public-private partnerships at the national, regional, and district levels. There are 4 models of partnerships that we enter into. The first is partnerships with government to improve private provider access to key commodities that are often only available in the public sector. These include contraceptive implants, ARVs, and TB drugs. We've also entered into partnerships between the public and private sector to improve private sector reporting into national health information systems a critical element for governments to be able to get a window into the total health system. We've also developed partnerships to increase public sector social insurance schemes' inclusion of private providers as an important source of care. And then finally, we brokered partnerships between associations that represent private providers and government to ensure private sector's voice is included in government decision-making bodies. We've put together data and public-private partnerships in a number of countries in which we've worked, including Senegal, which you can hear about as part of the webinar series. But I'd like to talk to you right now about Nigeria. For the past 4 years, SHOPS Plus has been working on a public-private partnership in Nigeria to improve screening, testing, treatment, and monitoring of TB clients and to link patients of private providers with free government-supplied TB tests and treatment. Given the use of the private sector for health and the large number of missing TB cases, over 300,000 per year, an engaged private sector was a critical part of Nigeria's plan to reduce the burden of TB. SHOPS Plus partnered with over 5,000 private facilities, including drug shops and pharmacies, clinics and labs, to identify, screen, and treat tuberculosis cases. Data has played a key role in making this public-private partnership work. The program has digitized all patient data so that patients don't experience delays due to the transfer of paper records, referrals, and lab tests. As a result of the digitized system, the program knows when and where there are private providers and laboratories that need to be supplied with government commodities. State and national TB programs are able to analyze data on program performance, identify hotspots, and direct resources appropriately. In Lagos and Kano states, private sector providers identified over a quarter of all TB cases detected in 2020. The effectiveness of this public-private model convinced the government to further collaborate with SHOPS Plus to expand the model across 14 additional states, demonstrating that data-driven public-private partnerships can result in impact at scale. Another form of partnerships that was a key component of our work was partnerships with corporates. We brokered partnerships with 30 companies over the life of the project. This included partnering with companies such as MTV and Viacom18 to improve access to information, partnerships with manufacturers such as Mylan, Dr. Reddy's, and Meditech to improve access to priority health products, partnerships with companies like Twinings Tea and Tata Realty to improve access to health services for workers along their supply chains, and partnerships with commercial banks and microfinance institutions to improve lending to the health sector. In closing, I just want to say how excited I am by the range of private sector engagement strategies to improve health outcomes that I see happening around the globe. And we look forward to sharing with you some of what we've learned over our project at our upcoming events. So I hope you'll join the conversation, and I look forward to seeing you there. Thank you.